Hello, this is Dr. David Greene with the Arizona Pain Network. Today's topic is what you need to know about Facet joint syndrome. Well, what exactly is Facet joint syndrome? This is a view of the back of the spine, and every level of the spine has two facet joints. There's a joint on the right and a joint on the left, and they're about the size of a thumbnail, and they contain cartilage just like other joints in the body that are mobile. They do allow, in combination, an impressive range of motion for the spine, and even these small joints can be a tremendous source of pain. Well, how does facet joint arthritis start? It actually starts not even in the joint, it starts in the disc. What you see here on the left is from the front. These are the bones and these are the discs. This disc is fine, nice and fluffy, a lot of water in there. This one is not, and these are fine. But this one is not. It's losing water, it's losing height as a result of not having as much water content. Now, why does that start arthritis in the back? Is because when this gets abnormal, it pushes stresses to the back of the spine when you start to end up with an appearance like this, where you have a ratty appearance to the facet joint, cartilage is degrading, overgrowth of tissue is occurring, and you start to get what's called facet joint syndrome. It's not truly a syndrome, but it is referring to arthritis and pain coming from the joint. Why is facet arthritis more complicated than hip or knee arthritis? Well, there really is no effective facet replacement like there is in the hip or the knee. There are two facet joints at every spinal level, and you usually have multiple affected. Okay? You only have two knees, you only have two hips, you have over 40 facet joints. So if you have multiple facet joints affected, it's not going to be as simple as doing a joint replacement, and even then that doesn't exist. So, and even small joints, as mentioned, may produce significant pain or none at all. So why do people develop Facet syndrome? The most common reason is degenerative wear and tear, just like at other joints. Also, there's post-traumatic. Here you see pictorials of whiplash when you have a car accident. That can cause injury to the facet joints and cause arthritis post-traumatically in the neck. There's also a genetic component. We don't really understand that very well. How's the problem diagnosed? Well, pain doctors can do a history and a physical examination, x-rays, CAT scan, MRI. You can get an idea that facet joint arthritis is causing pain. You can see facet joint arthritis on imaging studies, but it may be, you may have asymptomatic patient who has really bad arthritis on evidence, or vice versa. You may have slight facet joint arthritis on MRI and x-ray, but you may have a really painful patient. So interventional procedures can help diagnose the problem, which makes them both diagnostic and therapeutic. Here's an injection going around the joint here, and it's numbing up these sensory nerves called medial branches. That's why it's called a medial branch block. There's also injections that can go right into the joint with steroid called a facet joint block, okay, and that can get pain relief as well as help diagnose the problem, if relief is seen. What are the overall treatments? Medications can be very helpful with nonsteroidal anti-inflammatories such as ibuprofen, Advil. Tylenol can be helpful. Short-term narcotics can be great. Over the long term, though, they just don't work very well. The risks start to outweigh the benefits. There's also some creams that can be put over the painful areas. Physical therapy and chiropractic treatment have been shown to be exceptionally helpful for facet joint arthritis. TENS units have little foam pads that go over the skin. They put a little electrical impulse to the skin. They can alter the way the brain perceives pain signals. And then what you see here, spinal decompression therapy, involves computerized intermittent spinal traction, and that can help relieve pain over 85% of the time for anywhere from 3 to 9 months. Interventional treatments, let's go back to the medial branch block. So what you see here is this is a facet joint, okay? It has to get sensation from something, all right? And it's these little tiny nerve endings. So here's a nerve root, and the little medial branches are coming off supplying sensation here. If you can block these with what's called a medial branch block, you can get pain relief, okay? And that can help diagnose the problem, and it can also help give pain relief for months. Also, the pain doctor can do an injection right into the joint of steroid. That's a facet joint injection, all right? There's also a radiofrequency ablation. But here's a facet joint injection. It just goes right into the joint with steroid, just like any other type of joint injection. that can give pain relief for months and help diagnose the problem. When you start talking about a radiofrequency ablation, a catheter is placed around the joint, and it heats up and deadens these medial branch nerve endings, just like a medial branch block does. This can provide pain relief for anywhere from 6 to 18 months and do really well with a repeat procedure when necessary. What is the typical outcome of treatment? Well, a medial branch block in and of itself, besides giving diagnostic information when it gives pain relief, it's 85% effective, and it can give average pain relief of 3 to 4 months. And when it wears off, it can be simply repeated, or the person can go on to have a radiofrequency ablation. An RF procedure can give 80 to 85% excellent results, pretty much the same numbers, but it can be 6 to 18 months and be repeatable. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with Facet syndrome. Surgery for Facet arthritis has just simply not produced the excellent outcomes over time that we would like to see when you compare it with the risks involved. Arizona Pain Specialists has the top pain management clinics in Arizona. There are 6 locations that accept over 50 insurances. The doctors have won the Patient's Choice Award 5 years in a row. Okay. The phone number to call for scheduling is 602-507-6550. And visit us on the web at preferredpaincenter.com. There's a huge online library of educational information. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.